The Filipino American Cancer Care now brings you On the Air with FACC, tributes and support to those impacted by cancer. On the Air with FACC, the Filipino American Cancer Care on PHLV Radio.
Good afternoon or good evening, ladies and gentlemen. Welcome to our radio show On the Air with FACC, Filipino American Cancer Care. My name is Josie Moralidad Ziman. I'm the president and founder of the Filipino American Cancer Care here in the DMV area, DC, Maryland, and Virginia. Good morning to all our listeners, viewers in the Philippines and all over the world, Kung nakikinig kayo at nakikita nyo kami, please tune in dito po sa ating Cancer Advocacy Radio Show on PHLV Radio. And thank you so much to our station manager, Johan, for giving us the opportunity to be with us this afternoon. Okay, our special guest tonight, she is an 18-year-old social impact leader planning to pursue economics at Harvard University. She is very enthusiastic about change making, youth leadership, and childhood cancer awareness month. Childhood cancer awareness. Her academic interests lie in social entrepreneurship, business policy, and public health. She is the founder and executive director of international nonprofit Cancer Kids First, which works towards normalizing the hospital environment and providing a loving community for pediatric cancer patients and their families as they navigate the uphill battle against cancer. She has also served as the only youth on 2 medical boards and has cultivated 187 youth leaders in growing their own chapters organization. She strongly believes in uniting the younger generations to make positive change and discusses her journey, youth leadership, and nonprofits at speaking events. And of course, she won the award, and we would like to congratulate her for winning the Diana's Award. Ladies and gentlemen, please welcome on our radio show On the Air with FACC, Filipino American Cancer Care, Olivia Zhang. Hi, Olivia.
Hi, thank you so much for having me.
I'm sure, you're very good in public speaking, and we only get to know each other. I only, connected with you through Instagram, and you were so nice to accommodate my request.
Oh yeah, of course. I'm super excited to be on air, and I think that what you guys speak about is really important.
And thank you so much for giving us the opportunity. And you just told me this afternoon that you were taking some exams, but then you're giving me this time to, to interview you on our radio show. Before we go on with some of these questions related to your award and, of course, to your cancer organization, can you tell us something about your background, about your family background, and where do you live around here in the DMV area? Because I live here in Alexandria, in Kingstown.
Yeah, for sure. So I was born in Georgetown Hospital, and me and my family, it's a family of 4, and I have a younger sister. We first lived in Arlington, and then we eventually moved to McLean, Virginia, where I currently live, and we've lived there for the past 10 years, I believe. So that's kind of where I grew up and where I went to high school. And then right now I'm just studying in Cambridge, Massachusetts at Harvard University.
Well, congratulations. Your parents are both Chinese or Caucasian?
Yeah, they're Chinese, and they moved here or immigrated to America when they were around 30 years old.
Have you been in China? Have you visited China?
So we try to go. Yeah, we try to go every other summer just so because all my grandparents, aunts, uncles, etc. are all there.
Mm-hmm. Do you speak Chinese?
Yes. But my writing is not very good, but I can speak and understand very well.
Okay, thank you so much. Now, what inspired you to become a social impact leader at such a young age? At the age of 18, I'm sure you would like to be with your friends, you would like to explore more. But here you are, a social impact leader. What does it mean, by the way?
Y-
A social impact leader.
I think for me, it's about, I guess, leading change to address a social impact issue in your community or even just in the broader world and uniting groups of individuals under your cause and kind of directing, I guess, initiatives that help resolve like said issue that you want to address. And kind of the backstory of why I think that this like role is very important to me. I think it all stems from my nonprofit, Cancer Kids First. So the biggest issue that I saw when I was younger was cancer because my grandfather and elementary school teacher were both diagnosed with cancer, and then they eventually passed away. And that was very difficult for me to navigate when I was younger. And I think seeing my grandfather go through chemotherapy, that just struck me as to, the difficulties that these patients face and how cancer affects not just the patient, but also the family and their loved ones. And so that's what pushed me to get into childhood cancer work and just cancer advocacy in general. And by leading my nonprofit, Cancer Kids First, I was able to also just meet a bunch of different diverse leaders, travel to different places across the world, and I witnessed a lot more just inequalities in healthcare as well as just general societal issues. And I think that because I have the resources and kind of, I guess, platform to help resolve some of these issues, I think that it's very important to do so because there's so many different vulnerable groups, in our world. And that's kind of what pushed me to, I guess, become a social impact change maker.
Mm-hmm. How close you are to your grandfather and to your teacher?
I was really close to my grandfather. I would see him every other summer when we would visit. And then my elementary school teacher, she took care of me after school every day because my mom would
Wow,
work
that's
late.
very nice.
So yeah, so we would bond all the time. And I was also a very shy kid when I was younger. And so both of them were really big on, I guess, getting me to like open up. And so they were really just instrumental to my general growth.
Mm-hmm. How did you find out that your grandfather was, diagnosed with cancer as well as your teacher who was very close to you?
Yeah, so I mean, my grandfather, I found out just through my dad and my family. And then my elementary school teacher, I actually heard from another student who she also taught. And the center like that she works at also informed me.
Mm-hmm. What was the impact of, their cancer diagnosis as you were growing up, personally in your
Yeah,
case?
yeah, it was very difficult. I think it was a lot harder with my grandfather because when I visited him in China, I would have to see the effects of cancer and chemotherapy on him. And so he would not leave the room. Like he would be in the same room for weeks and he wouldn't eat or talk to anybody. And it was just very heartbreaking to see because that was really different from, the man that I like remember. And so that was just very difficult and upsetting, I think, to witness like the physical and mental detriments that cancer has. And then with my elementary school teacher, I found out that she passed away really quickly after I found out about her diagnosis. And I think just not having the time to talk to her one more time or see her one more time, I think that was really, really hard on me. And so as a whole, I just remember after I found out, I ran home and I was just crying and screaming and throwing things for
Mm-hmm.
hours because I was really upset and angry just at the world in general for taking away two people who I considered to be really just strong and loving people. So I guess that was kind of my first like emotional like,
Mm-hmm.
reaction.
Yeah. So what kind of cancer did they have?
So my teacher had breast cancer, and then my grandfather, he originally had lung cancer, but then it kind of just spread throughout his body.
Okay. Now, how did your passion for change making and youth leadership, influence your decision to pursue now economics at Harvard University?
Yeah, so I mean, I think it stems back to the fact that, like, with economics, and hopefully I'll do a secondary in global health, but I think that with econ, there's a lot of great ways where you can use data and um, different like graphs and statistical tools to address different societal issues. And a lot of the classes at Harvard, it's not just teaching you about, all these different graphs and the basic knowledge of economics, but it's relating it to different societal issues like racial inequality, gender discrimination, etc. And so I really like the business avenue, and economics is very, tied into business. And so it's kind of just learning how you can use different avenues like business to help impact different populations. And so I think that's kind of why that influenced my decision to do economics.
Mm-hmm. And by the way, what personal experiences, aside of course, your um, aside from that cancer diagnosis of your teacher and your grandpa, aside from that, what personal experiences that you encountered or motivated you to dedicate your efforts towards childhood cancer awareness and, of course, supporting pediatric cancer patients? What motivated you? Can you hear
So
me?
I
Yeah.
think the starting point was definitely, yeah, sorry, you usually glitched out a little bit, but I think the starting point was definitely there or losing them. And then eventually it was talking to these patients and their parents. I learned a lot more about how cancer truly like, affects just everything that a patient kind of goes through, as well as, their family loved ones. And I also got the opportunity to meet patients from various different countries, 19 countries, in fact. And a lot of the treatment diagnosis is very different in these countries, and how cancer impacts them is also different based on the country. And so I would say that their stories motivated me even more to engage in childhood cancer awareness, because I learned a lot more about like the gaps in childhood cancer care.
Mm-hmm. How did you tell your parents about this? Creating a cancer organization is not that easy. I know it for a fact. When I was diagnosed with breast cancer in 2018, I did not even realize that I'm going to have my own cancer organization. And having a cancer organization, you are dealing with people who are fighting for their life and time on this earth. So, how did you open up this conversation to your parents at a very young age?
Yeah, so I mean, I was 14 when I first officially founded my nonprofit, and I actually didn't tell my parents until a few months later when we were expanding a bit more, because I thought that their mentorship would help, scale my organization. But I kind of just shared, I mean, they saw firsthand how much my grandfather and elementary school teacher, how their deaths impacted me. And so I kind of just shared, I guess, the ideas that I had in terms of why I thought it was very important to start a charity, or just in general take action to honor their legacies, and then also do work for the childhood cancer field. And they were both like very, very supportive. My mom, she also works in the nonprofit sector, so she had a lot of great advice in terms of like financials and reaching out to different stakeholders in terms of how I can improve Cancer Kids First. And my dad is a entrepreneur, and so he was very helpful too in kind of just sharing tips and advice in that area.
Mm-hmm. Do you have the support of your friends as well when you created this organization?
Yeah, I mean, especially now, I guess, like because we've grown so much, we've gotten a lot more support. But most of my friends, I would say, were pretty supportive when I was first starting out, but I was a little bit, I guess, like scared to, share Cancer Kids First with everybody, just because I didn't know if it would actually like work out. But now that we're a lot more of a, well-established organization, so many of my friends just really support it, whether that's donating or reposting one of our posts on social media, spreading awareness about the work that I do, and also just contributing to different, I guess, like interviews or event ideas, sharing partnership ideas too. So everybody, I would say, is very supportive, and I haven't met anybody, I guess, who's said
Mm-hmm.
something like negative about it.
So is this like a volunteer organization?
Yes.
Okay. You know, Olivia, it's not easy. You know that.
Yeah.
It's not
Yeah.
easy to manage an organization. You're like the CEO of a business company, but this one is
Mhm.
non-profit. And raising funds, asking donations is also challenging.
Mhm.
Now, can you describe the mission and goals of your international nonprofit Cancer Kids First? And how did you come up with that idea that you have to make it international?
Yeah, so our official mission is to normalize the hospital environment and provide a loving community for kids with cancer. And we do this through five different service programs: arts, toys and books, care packages, treatment services, and patient interaction. So some things that we donate or provide, for instance, are virtual and in-person interactive events to help patients with social isolation. We also provide oncology staff training for oncologists in low-income countries. We provide toys and books, arts and crafts, care packages, etc., to kind of spark some happiness within patients' lives. And then I guess the was your second question, sorry, about the how we
Yeah, the
decided on the mission
goals, and
or make it.
yeah, what made you decide to make it like an international Cancer Kids First?
Yeah, so I think our mission, it definitely changed and adjusted throughout the years. Originally, I just wanted to honor my grandfather and elementary school's teachers' legacies. And my grandfather, because he was also a teacher, he believed in putting students first. And so our name is Cancer Kids First because I wanted to kind of play on that, and put kids with cancer first. And so that's kind of how our name came to be. And then obviously prioritizing the kids, that also means prioritizing their childhoods, their happiness, their well-being. And that's kind of how our different service programs got created.
Mhm.
And then I think just deciding it to be international, it was just about witnessing how many patients reached out to us from overseas. We originally had to establish a patient network and database just by reaching out ourselves. But once we grew into a larger organization, a lot of parents and families started reaching out to us, and we had patients reaching out to us from like the Philippines, London, all these different areas, and they shared their stories about how treatment was really different compared to the United States, where healthcare is a lot more accessible. And that's kind of, I guess, when I realized that there's so many more patients that we needed to help outside
Mhm.
of the United States.
Have you visited Philippines?
No, I haven't. I actually haven't been able to do any in-person trips. So we have a lot of ambassadors and chapter leaders who help us facilitate that.
Mm-hmm. You know, after 21 years of being here in the United States, I went back to the Philippines in 2023. We have, in our organization, we support, cancer kids as well. And there is a province in the Philippines that I visited. We're supporting these 50 kids, all with acute lymphoblastic leukemia. And I saw it, I saw them, and some of them they
Mhm.
passed away, but some of them are most of them are actually surviving right now. And I don't understand why in third world countries there are so many kids that are suffering from leukemia. And I'm sure we have it here in the US, but we are so lucky that we are here in the
Mhm.
US because, we have our insurance, or if we don't have insurance, we have charity organizations, we have Medicare or Medicaid, but not in the Philippines and other third world countries. And I also found out in
Yeah.
Zimbabwe, Zimbabwe, there is only one
Hmm.
cancer center in the whole nation, in the whole country.
Hmm.
So, what can you say about your experience? You told me that you visited those 19 countries. What was it like for you? Because, it's too overwhelming. In our organization here, we give financial assistance to help them with their medical treatments,
Hmm.
but that's not even enough. And it's very
Right.
heartbreaking.
Yeah, for sure. I think what you pointed out is really important. And it's definitely something similar to what I've seen and what our ambassadors and other volunteers have seen as well. So I think one, I guess, story that stands out in particular was we went to Colombia to deliver originally what was supposed to be toys and books following our toys and books service program because in the United States all the or most patients already have access to food, water, etc. So all they kind of, I guess, need is toys and books to help take their mind off of treatment. So that's kind of what we went into Colombia with, our intentions. And then our ambassador Valentina, she talked to the hospital directors and they mentioned that a lot of these patients, they lost their parents to drug overdoses because that was very common in that area. So they were orphans and they not only had to deal with, not having parents, but also they were extremely poor. So they couldn't afford
Mm-hmm.
basic necessities like
Yeah.
toothbrushes, masks, pain medication, food, um, on top of just cancer. And we did a drive where we donated a bunch of those basic necessities. But I think just hearing about their experiences, that was just like you mentioned, like very, I think, shocking because it's so different to how patients are like in the United States.
Mm-hmm. So, how do you envision the future of Cancer Kids First and its impact on pediatric cancer patients and, of course, their families worldwide?
Yeah, so I mean, something that we are really focusing on right now is expanding our treatment services program, which is focused on helping patients in low-income countries. So we're trying to establish a lot more partnerships with international hospitals and nonprofits to kind of expand our services there. So ideally, I would love to get the number of countries that we aid uh, to 25 in 2025. So right now we're at 19, so hopefully we're able to expand that. But more so than that, I also want to ensure that we provide like consistent care for these families and it's not kind of just a one-time service and then, we never help again. So keeping these like connections with families and ensuring that they know that we are there to support them. And then if something happens, like a relapse or some difficulty that they have, like they know that they can come back to us again for help. I think those two are kind of our biggest like avenues that we're working on just because I would love, hopefully, that in the future, Cancer Kids First is kind of known or thought of as the first organization that these families like turn to when they need help.
Mm-hmm. Where do you get your funds, like, for example, or resources? Because you travel to different countries and everything is expensive right now. And how many
Yeah, for
members
sure.
or volunteers do you have at this time?
So we have 40,000 volunteers in 63 countries. And I would say most of our funds and money come from, we apply for grants. So a lot of nonprofits and businesses will give us grants. And then we also do a lot of different fundraising events. So we partner with companies like Kendra Scott to sell products, and then we get a percentage of profits back. We also recently were doing a merch competition, so we're gonna sell some of our merch and then make off some profit from that. So we do it through that way. And then we also have a lot of volunteers, chapters, ambassadors who they host like local fundraisers within their community to help us raise money. So that's something as small as doing like a lemonade stand or doing a like walkathon in their community to help fundraise.
Mhm. And what challenges have you faced in your role as the founder and executive director of Cancer Kids? And, how did you overcome the challenges?
Yeah, I think the biggest one starting out was definitely getting adults to believe in a 14-year-old. Um, we experienced over 60 hospital and business partnership rejections before we got our first one. And so just it was, I think, very unmotivating to see us get rejected. And I think it's because adults have a really negative stigma around youth-led nonprofits, either
Mm-hmm.
because they think that we're starting it for non-altruistic reasons, or because, they don't think that we have the dedication or the time to, commit to the cause. And so I found a lot of mentors who were really great in helping me learn how to pitch ourselves efficiently through like slide deck presentations in person, and then also conveying like my passion and my story through emails, calls, and that just really helped us, I think, reach all these different businesses, hospitals, and get that ball moving forward.
Mm-hmm. How do you balance, Olivia, your academic pursuits? Because you told me you want to be an economist and you're studying at Harvard. So how do you balance your academic pursuits with your leadership responsibilities and advocacy work for childhood cancer awareness? How do you balance your time? Because me, I'm 51 years old. I don't even have time anymore. Running a cancer organization, there's a lot of paperwork. At the end of the day,
Mhm.
you are in charge of everything, even the
Yeah,
social media accounts.
yeah, yeah. It's very difficult, and I think it took me a while. That was another big challenge that we faced, was definitely the time management aspect. In sophomore year of high school, when we first started really expanding, I was prioritizing Cancer Kids First a lot over my academic pursuits. And my math teacher actually had to sit me down and tell me that I was failing and that I needed to step it up. And so that conversation was like a really big wake up call. Like I realized that I had to find leadership team members who were really capable and as dedicated as I was to the cause, so I could delegate tasks. And doing so, like we have an exceptional group of people on our team now. I believe it's 25 to 30 people, and they come from all across the United States and also from Canada and other international countries. And they all have such great talent in the work that they're doing. So they are a huge, huge help in helping me just balance everything. And then also just using like a planner to manage all my tasks, um, doing like time blocking, which is a skill that I learned off of social media actually. And basically, you set your timer for a set amount of time. And then, for instance, let's say I have 1 hour to finish my uh, economics homework. And then within that 1 hour, I have to finish it. And then after the hour, I can move on to something else. So seeing that time ticking
Mm-hmm.
down, like that gives me pressure to really focus.
Yeah.
I also do like time limits to limit the time I spend on different social media apps so I don't really get distracted. And then also just knowing yourself. Like I know that I work best in the mornings. So I try to do all my work in the mornings and not save it for later on in the day. So I guess that's the different like tools and tips that I use to balance my time.
Mm-hmm. Okay. So what did your parents say about this? I can't
I
imagine
mean,
you
they
every day of
definitely
your life.
they definitely think that I should prioritize my academics a little bit more. But I think that they've been pretty hopefully proud so far of how I've been able to balance everything. But I just know that they really think that academics should be my first priority. And in high school, I think Cancer Gets First kind of overtook that. So I don't think they were super happy with that aspect, but I think I've gotten better at balancing it.
Yeah, because young kids like your age, most of the time their advocacy would be like bullying, mental disorder, empowerment, diversity, inclusion. But in your case, this is a very serious matter. Cancer.
Mhm.
It's not easy. If you don't have the
Yeah.
passion, that's what I always tell people, you know, because you're also absorbing the pain from the
Mhm.
families, from other cancer patients, from even the survivors.
Mhm.
So, what can you say about that?
I think that's a really great way to put it. And I really agree with that. I think I mean, no matter what kind of service work you do, I think that if you don't have the passion for it, it's going to be very hard for you
Mm-hmm.
to stick to it and continue it,
If you don't have the
especially
heart.
when going through challenges.
Mm-hmm.
Yeah, exactly. Especially when like faced with challenges. Like when I was starting out with all those hospital and business rejections, that was obviously very hard to, process that rejection. And that caused me to pause like my work on Cancer Kids First for a few months. But the reason why I started back up again was because I had that like personal, story driving my passion for wanting to continue to do it. And oftentimes when leaders who don't have passion for what they do, when they hit like a roadblock like that, like they kind
Mm-hmm.
of just stop and then not continue it. And I think that's why we see so many like businesses and companies like all fail. But if you really believe in what you do and you, I guess, like that's gonna make you push to work like towards it. So I completely agree with what you said.
Okay. So, one of the aspects also of running an organization, the challenge is always the financial, Now, in our
Mhm.
organization, that's always been a challenge on my part because we give money, but we don't have money.
Yeah,
And sometimes, did you ever use your own personal money? Because I have to admit, I'm using, my personal money just to compensate with other expenses. Like I don't even
yeah.
charge the
I mean,
organization for gas and mailings.
yeah. No, I think that's definitely something that a lot of nonprofits face, especially like youth-led ones too, is just struggling with fundings. And that was one of our biggest obstacles too when we were first starting out. When I first formed Cancer Kids First, I definitely did use some of my personal funds, but I guess I just saw it as like a donation. And my parents were also
Mhm.
really great in just
Mhm.
supporting,
You're the
whether
founder,
that
you're
was like
also the
buying pop.
donor. You're the founder and you're the donor.
Yeah, yeah. Like my parents, they would help if we were doing like a popcorn fundraiser, they would buy like a lot of bags of popcorn to help us earn profit. So they were really great in supporting that. But now I think we're lucky enough that we've been able to apply for enough grants that we have enough funding as of right now to kind of cover all our expenses. But definitely just moving forward, like applying to more grants and hopefully getting them, like that'll help with the financial problems.
Hmm. Now, Olivia, what role do you believe you play as, a role model for other young leaders? And how do you inspire them to take action in their communities? Because some young generation, they will not participate. They want to enjoy life. They
Mhm.
want to go out and eat,
Yeah.
and and they can do it on social media. They're very active in social media, but it's not always easy to
Yeah.
motivate and inspire others.
Yeah. No, that's very true. I would say that's actually why I started my own social media platform because I know how many young people are on it. And I think that essentially what I try to do on my social media platform is share my story and then share tips on how other people can start their own nonprofits as well to hopefully just spark action. And I also just really try to encourage individuals to take a look at, community issues around them and see if there's any way that they could use their resources and skill sets to address those problems because ultimately you helping another person like that's gonna improve your life as well as theirs and together like that'll build a better society and a better world. So I don't think there's many like downsides to it. So I think it's just a matter of making it seem like enticing and showing them the benefits of that. So I really try to do that like through my social media accounts.
Mhm. I always tell people we don't get anything out of this nonprofit organization. The people that will benefit from running a cancer organization are the cancer patients, right? The
Mhm.
beneficiaries, those people that are affected by this horrendous disease. Now, can you describe um, particularly impactful interaction you had with a pediatric cancer patient or family that, they reaffirm the importance of your work as a leader, as having the Cancer Kids organization?
Yeah, so I can think of a lot. I would say so one of them, this is actually what really pushed me to create our treatment services service program. Her name was Una, and she was 10 years old. She was diagnosed with neuroblastoma, and she lived in the Philippines. And her family couldn't afford treatment, and she was referred to three different hospitals actually to get the appropriate treatment that she needed, but
Is
she
she
couldn't
here or
afford.
in the
Um,
Philippines?
she's in the Philippines,
Okay. How old is she?
10 years old.
10 years old. Okay.
Yeah, and she was referred to three different hospitals and she couldn't afford the treatment that she needed. And so her mom had reached out to us over Instagram DMs for help. And
Mm-hmm.
I really got to know her story just through conversing through Instagram DMs. And it was, I think, just really heartbreaking to hear about how, because of financial difficulties and financial
Mm-hmm.
barriers, like she couldn't get like life-saving treatment. And she passed away on my birthday actually. And so that is just always a patient that I will remember. And I think her journey just really reaffirms like the need for a treatment services program in the sense that financial support is needed, like medical equipment is needed, as well as training for these different oncology staff.
That's right. Yeah. In the Philippines, we have the best doctor, but we don't have enough technologies
Hmm.
and resources. In the FACC right now, our youngest beneficiary, can you believe it? It's 9 months old with brain
Oh,
cancer.
wow.
Yeah. And a lot of them are waiting to be helped. But, what
Hmm.
can I do? I cannot save the world. I can only give
Yeah.
like, I have to, right now, as a new organization, we're still trying to find ways how to get a grant, how to be able to raise more funds for cancer
Hmm.
kids. Because third world countries, I believe, I always, believe in that song. I believe the children are our future. You know what I'm saying? Their survival rate
Hmm.
when it comes to cancer. You never know. These kids someday will be like you. Now, let's talk about the significance of this award that you received in London. Can you describe to us the importance of receiving the Diana Award in London and how it reflects your dedication, your passion to serve, and of course, the impact in the community. How did you find out about it?
Yeah. Yeah, so I was actually nominated by one of our partners, um, and that's kind of how I heard about the Diana Award. But previously, it is the highest accolade that a young person can receive for social action work. So it's pretty known in, I guess, the community service community. And I had heard about it previously, but I didn't officially like know what it was until my nominator nominated me. But it's basically an award that honors Princess Diana's legacy. So she's known as the People's Princess, and it just highlights young people who engage in humanitarian and social action work. So that can be running a nonprofit, that could be just starting a service project or campaigning for climate change policies, things like that. So there's a lot of different forms and how it can look like, but I think it's really meaningful to me because the main message of this award is that young people can change the world. And as mentioned before, that was a huge, obstacle that I had to navigate and something that I had to learn to believe in. And so the fact that I was able to, I think, win this award that carries this message, that's just really important to me because I can reflect back and see all the growth that I made as a leader and the growth that our team in general has made together. Um, and I think that's honestly like the most meaningful part, as well as just Princess Diana has always been somebody that I really looked up to as a role model. And so being able to win this kind of in her legacy, that's an incredible honor.
Mm-hmm. So when you found out that you were going to get the award, what was it like for you? And I saw the pictures you have with Prince William.
Yeah, I mean, the actual ceremony was just incredible, like so much better than I could have ever imagined. And I've said this multiple times before, but I'm not very good at processing things in the moment. So when I first found out the news, it didn't really, hit me until a few weeks later. And then I was so excited, particularly like by the opportunity to travel to London and meet these other change makers and get connected with them and learn from their stories, as well as, of course, meeting Prince William and Prince Harry. And I immediately called my mom to tell her the news, and we kind of like celebrated together over FaceTime.
So you did not bring your parents.
So you could bring one guest, so I brought my mom.
Oh, so she was with you. Wow. And
Yeah,
what about your
yeah.
friends? Were they surprised?
I actually am sitting with one of my friends here right now. Were you surprised
Oh, she was
when
with
I
you?
won? No, no, no. But everybody I think was definitely very shocked because we had to sign a NDA to because we couldn't share it without the castle and the palace in general sharing it first. And so I couldn't tell anybody. I just told people that I was going to London for a business trip. And so I think a lot of people were definitely very shocked when I announced it on social media.
Mhm. So, aside from receiving an award, were you able to take a tour of the Buckingham Palace?
So the palace wasn't open for us. But we just met with Prince Harry over Zoom, and then he had like a very inspiring conversation with us. And then Prince William met us afterwards at the ceremony, and individually talked to us as a group too about the work that we were doing. And we did a bunch of different like workshops throughout the week, as well as like tours of London.
Mm-hmm. That must be one of the most memorable moments for you that you will never forget, huh?
Yeah, for sure. I mean, the fact that I think, able to meet royalty at age 18, that'll definitely be something that I remember forever.
Mm-hmm. Was Princess of Wales, Middleton was there also? Was she there?
No, she wasn't.
Okay. And that was when? When did you receive the award?
I mean, I officially found out in October of 2023, but the ceremony was March 9th, to March 15th. So it was a week long of like workshops and everything. And then the official award ceremony was on March 14th.
Mm-hmm. So talking to Prince William, how would you describe him? First impression of him.
Yeah. Sorry, I think this might have to be the last question because I do have to go.
Yeah, I still
Um,
have two more.
but okay, okay. So I would say, well, first of all, he was a lot taller than I expected. He's like 6'5". And he was very well spoken, which I kind of expected. He talked a lot about, how him and Catherine really believe in his mom's legacy and that he really believed that the work that we were doing were important and he admired how we balanced it with school and everything else. So it was really great to, I guess, like receive affirmation from someone like him.
Mm-hmm. Now, my last two questions, what are your thoughts about cancer? Are you scared of cancer?
I mean, yeah, I think that to me it's become a little bit less scary because I've met so many patients and heard so many stories and kind of witnessed it a lot more. But it definitely is really scary just because I think it can obviously take away somebody's life, but it can also make somebody's life so much more miserable. And also losing somebody to cancer, like it impacts the people around them, and the greater community as a whole. And so it's not just a disease that affects one person. So I think that's a big part about what makes it so scary.
Okay. And last question. What lessons can other young leaders from your journey, what do you think, as a founder and of course leading this largest youth-led cancer nonprofit in the world, what lessons can they learn from you and what is your message to the young generation?
Yeah, I think that, I mean, hopefully the biggest lesson that they take away is that, as the Diana Award says, that young people can change the world. I think that I, for too long, was really scared about approaching adults for partnerships. I was scared about sharing Cancer Kiss First out to people because I was afraid of people's reactions. And I think that fear prevented a lot of work and progress that we could have made as an organization. And so I would just encourage young people to take that leap forward in, starting a service project, expanding it, etc. And also just think about the resources and networks that they have around them and trying to utilize those to kind of grow their nonprofit.
Okay. How about those families or cancer patients that are listening to us right now and they would like to reach out to your organization? What are your
Yeah,
words
so
of wisdom or your thoughts?
I would definitely say to remember that what they're going through is, incredibly difficult, and hopefully they see that there's so many people out there who love and support them, and if they ever, need assistance, they can reach out to all these like various organizations, including Cancer Kids First. But just remembering that there are people who care about them and who love and support them, and also to remember that what I think that what they're doing is they're doing their best right now, and not every day might be like perfect, but just trying to maintain positivity and remember that there's always, I guess, like light at the end of the tunnel.
Okay, so thank you so much, Olivia Zhang from Cancer Kids. And thank you so much for giving us this opportunity to share your stories and your time with us. Congratulations, best wishes. Thank you so much. Again, we wish you all the best in life. Thank you with us. Thank you so much, everyone, for being with us on this radio show on the air with FACC. Filipino American Cancer Care. Bye.
The Filipino American Cancer Care has just brought you On the Air with FACC, tributes and support to those impacted by cancer. On the Air with FACC, the Filipino American Cancer Care on PHLV Radio.